Hello, my name is Philip Neff, and I'm a pediatric hematologist oncologist. I was interested in healthcare or medicine, anatomy, that sort of stuff from way back when I was a kid. I remember looking in the encyclopedia and going through the little anatomy charts and being fascinated with that sort of stuff. But I didn't have aspirations for medical school when I went to college. I had aspirations to play baseball and I thought I was going to be an engineer or something math-wise, but that didn't work out. And so as I weeded out things from my list of interests, medicine was always there. It was always there. It was always there. And so I finally reconciled with my inner self and decided that was it for me. I had a sports background, so I went to med school thinking I wanted to be a surgeon. I wanted to be an orthopedic surgeon, and I wanted to help some of the athletes that the physicians that helped me along the way. I thought that would be great. Went a couple years of med school. One of my first rotations in clinical medicine was in surgery. Absolutely hated it. Those poor people. It was terrible. So I was disheartened a little bit. And then when I rotated through pediatrics later, just kind of wandering around through med school, pediatrics, I was immediately at home. Mostly with the people that work in pediatrics. I was just comfortable, and then I could just see the kids and the families and that sort of, and it just pulled me right in. Here in Austin, we are different from a lot of groups. We are physician-led in our practice, meaning we have residents who rotate with us, but every patient who comes through our clinic sees one of the physicians. We don't have fellows, so again, we're much more hands-on. And I think our program, compared to other programs in the state, does a really good job of treating the social aspects of cancer care in pediatrics. There's lots of support, not only for the patient, but for siblings, for family members. It just goes down the line. I think we do a great job of that. And as we grow and get bigger, which is the plan, that's the challenge, is to keep that family-centered, individualized care that I know our clinicians all want to do as we add all the necessary therapies so that kids can stay here in Austin. What makes me different? Nothing. My sense of humor, maybe. I have the greatest job in the world. It's also the worst job in the world. When I treat kids with cancer, a lot of people look at it like, oh my gosh, how can you do that? Those poor kids. I'm like, yeah, I feel that too, but what I want to do is something about it. So I kind of look right past that. Oh my gosh, well, it's not the kid's fault. It's not the mom's fault. It's not dad's fault. It's nobody's fault. It's just unlucky for this child. And so I just want to make it better. I want to help get through the worst time in a family's life, and see if we can come out roses on the other end. I have a beautiful and wonderful wife and a wonderful family, and so I like spending time with them. I used to find myself distracted with things like sports and football and baseball and that sort of stuff. I still love college baseball, but it seems like in my job, there are times when my job comes first. So when I do have time, my family comes first, and my kids and my wife, and I just like spending time with them. And if it's at a baseball game, then that's even better.